At the emergency services wait times, they averaged 88 minutes, which is pretty long, just for that group. But for everybody else coming in, the average wait time was 22 minutes. If you go to child support, we are within 0.3% of meeting the requirements for the child support timeliness and establishment of cases on time. We slowly move up every quarter, and so we believe we're moving forward there, and we'll meet it for the year. If you look at the child support cases that are requiring enforcement, we are timely in that area. We are at 82.7%, so significantly above what the threshold is there. If you move on to closures, that's something else we're measured on. We are to be at 90%, and as you see, we are closing cases in a timely manner at 99.4%. Our customer service area in child support focuses on obtaining court orders for support. And you can see that we're at 88.3% have cases under order, and the goal is to have at least 86% of our child support cases under order. And we have consistently been at that 88% level. The goal for collections for this year is that we have to collect at least $15.2 million. And we are in the third quarter. We're at 75.1%, so we are certainly on target to collect that $15.2 million. Last year, we collected 102.7% of our goal, so we would like to collect that type of percentage again this year.
So Jan, what happens with the addition? Funds?
The money goes, it's money that's going to children. So that just means we got more money for the children that we're serving.
Gotcha.
Generally, it'd be arrearages and those kinds of things. Michelle is shaking her head, yes. So the child support staff are doing a great job. If we move into child care, we had $9.4 million that were available to be spent in child care. We're at 69.4%. We're serving right now about 1,440 children. We are running below our average or below our expenditure levels because of NC FAST implementation and some issues that have existed with that.
So are those issues that mean a provider's not getting paid, and so it doesn't show as spent yet because the state's behind on paying providers?
It means that there are a lot of system issues, and in fact, we have got a report that they're going to come and talk next month about what's going on in child care, but we've got a report. There were $64,000, excuse me, I had a heart attack, $64,000 that were potentially overpaid to providers. And that, as we have worked it, have recognized that it is significantly less than that. But you can't read the reports, you can't get reports to see where you are, and with implementation, folks have been slower. So we have started ramping up. You should see at the end of this month, the end of April, when we get that report, you should see more children enrolled and a higher spending level, because we reached out and added about 80 children from the waiting list, and so they would have gone in April. But without knowing what you've spent, it's just been very difficult to gauge this year.
Concern is that they're behind on paying, so you think you've got extra funds, you add new kids, and then they get that backlog processed, and suddenly those extra funds were really just not extra.
Well, yeah, and they've taken funds from wrong pots of money. For some of the counties, they took Smart Start dollars, and those counties didn't have Smart Start allocations. So it's just been difficult this year. We do have some underpayments in answer to your question, but we believe it's a very small number, and we're working with those families. The state wouldn't even let us begin to address overpayments and underpayments until the end of April. So they've been trying to figure out what they have in the way of overpayments and underpayments. So we are working hard on getting that done. But again, staff will report next month as to where we stand with child care and what's going on with child care, because I thought it was important for you to hear what is happening there. We are spending about 92% of our allocation, between 92 and 93%. We would want to be much closer to 100%. So we'll see where that goes. For our adult services, you can see that we're seeing continued growth in our adult protective services reports. We've had 330 reports thus far this year. And again, you see with our individuals served by the adults, adults consenting to say, yes, I would like this service. In this last quarter, we had 17 folks. The month before it was, the quarter before it was 30. And
That's
we are having to.
Individuals per quarter, that's not a cumulative thing.
No, it's per quarter. It's the new ones for that quarter. So then when you get to served with APS by court order, we do have to sometimes go to court because they will not consent to services. And so we had to get 18 court orders during that particular quarter to provide services. And if you've got any questions about APS, Cynthia's sitting back there who can help you. So now looking at the guardianship caseload, again, we are now at, and this is cumulative, we are now at 134 guardianship cases. And I keep reminding that when I got here 4 years ago, we had 80. So we established 15 new orders. We are giving orders, or orders are being given to other individuals in families who are willing to take on that guardianship, but frequently we are the only people who can serve. So you see that we had 33% this past quarter that had others besides us named as guardian. Okay, so if you move now to the fact that we're trying to keep folks in a safe and stable, least restrictive environment, these are our in-home services, such as the money we just talked about a minute ago. We are continuing to increase the number of slots used with our CAP program, and we have had a vacancy there. So I'm really pleased to see that we've done as well as we have. We have 73 folks who are able to use in-home aid respite services, and we've in-home aid and respite services, and we have used 75% of our SA in-home slots. Again, we are increasing the numbers of folks who are served. And so that's a good thing. And that means we're able to keep more folks in their homes as opposed to having to go into a facility. Protective services, you're going to see that we are doing, we've been up and down, but right now we are at 94.8% of our children are not repeat victims, and the goal is 95%. So we continue to push hard in that area. As far as child placement is concerned, we had 87% achieved permanence within 12 months of coming into placement. And the goal is 75%. Okay. Of our foster care youth, our goal is to have only 1 or 2 placements within 12 months. That is a real struggle for some of our children. We are at 85.5% right now. And again, it's important for children to have stability.
Are those all different types of placements, Jan?
All different types of placements. So then if we move into the 12 to 24 month period, we are at 60% right now, and the goal is 65%. Again, you're shooting for 1 to 2 temporary placements. So if you move on to the percentage of youth in foster care for more than 24 months, with just a few placements, 1 to 2 placements, we are actually slightly exceeding the goal of 42%. And so those kids have stabilized in that situation. Now, if you look at NC Fast, oh my. We have not gone into NC Fast yet. We continue to work towards that. We continue to be pushed back in going into NC Fast. The current date is August that we will go into NC Fast in child welfare. The state is continuing to try and fine-tune. They did bring some additional counties on in pilot status to work with the system. And so hopefully by the time we get into the system, most of those bugs will be out. So the vacant positions, we are slowly reducing the average number of days and the maximum number of days to fill vacancies. That is something that I think staff, supervisors are working hard. We recruited 18 staff in the last quarter. We still have a couple of positions that have been very hard to fill, and it's taking us a significant amount of time to fill those positions. They're primarily, we've got one in adult services and some in child welfare that have been very difficult to fill.
Jan, what is making it so difficult to fill?
Salary is one of the issues. The demand.
Demand meaning?
Demand for social workers, because there's a significant demand for social workers to be, and trained social workers specifically. We're not getting a lot of applicants for some of these positions that meet the qualifications that we really need to have. And if you look at the type of job that our folks are doing, they're on 24/7. They don't necessarily get to go home at 5 o'clock lots of days. And if you could work in other places, your day could be much more stabilized and you might not have to work weekends. And so I think the knowledge of the work we do probably keeps some folks from wanting to apply. But there's a lot of demand out there.
Is this true with all county departments, or is it?
County departments are really struggling.
For?
Social workers, primarily, again, in child welfare, but we are seeing some of those issues in adult services. And statewide, there's been a lot of push to try and figure out ways to do better recruitment, to entice folks to come. We're working with the universities. I mean, the counties are doing a lot. The NASW is working also to help us recruit. But they certainly are pushing that to be called a social worker, you need to have a BSW or an MSW. And you know, we have a fair number of staff who are MSWs or BSWs, but it's probably not even 50% of the staff that are doing social work here. So it's a struggle. Yeah, and then you've got to get folks into all the pre-service training unless they've managed to get it through other sources, which can take months to get that done. And of course, they can't work without the pre-service training.
This may or may not be the time to ask Dr. Bunch a question, and if it's not the time, y'all tell me. But are you seeing differences in your students as to the route that they are taking after graduating, say from a MSW program, or rather than going to departments of social services? Are you seeing them